A healthy 25-year-old woman took just 8 extra-strength Tylenol tablets over 2 days for a headache. Within 72 hours, she was rushed to the emergency room with acute liver failure and needed an emergency liver transplant to survive. This isn't a rare horror story. It happens to over 56,000 people every year in the United States alone. Today, we're diving deep into the world's most popular painkiller, and what you discover might shock you. Welcome, everyone. We are thrilled to have you here today as we uncover the truth about Tylenol, or as it's known globally, acetaminophen or paracetamol. By the end of this video, you'll know exactly how to use this medication safely, when to avoid it completely, and what natural alternatives might work better for you. Raise your hand if you've taken Tylenol in the past month. Now keep it raised if you read the entire warning label before taking it. I thought so. You're not alone. Billions of people worldwide pop these pills without a second thought. But today, we're going to change that. We'll explore the fascinating history of this medication, bust some dangerous myths, and give you the complete picture of what Tylenol really does to your body. Let's travel back to 1877. Yes, you heard that right, 1877. A time when cowboys roamed the American West, and the telephone was just invented. 2 French chemists accidentally discovered acetaminophen while trying to treat intestinal worms. But here's the twist. Nobody cared about their discovery for almost 70 years. Fast forward to 1955. A company called McNeil Laboratories was desperately searching for a pain reliever that wouldn't cause stomach bleeding like aspirin. They dusted off that old French formula, and Tylenol was born. But it wasn't an overnight success. The real game changer came in 1982, with the infamous Tylenol murders in Chicago. 7 people died from cyanide-laced Tylenol capsules. Instead of destroying the brand, Johnson & Johnson's response, immediate recall, tamper-proof packaging, and transparent communication, actually made Tylenol more trusted than ever before. Today, acetaminophen is the most widely used pain reliever on Earth. It's in over 600 different medications, from your basic headache, pills to prescription painkillers. We're talking about a $2.6 billion global market. All right, let's tackle some dangerous myths that could literally save your life. Myth number 1. Natural means it's safer than synthetic. Wrong! Your liver processes acetaminophen the exact same way. Whether it comes from a lab or a willow tree, the dose makes the poison, not the source. A synthetic aspirin molecule is identical to one found in nature. Myth 2. If 2 pills work, 4 will work better. This thinking sends 78,000 people to the emergency room annually in the US alone. Tylenol has what we call a narrow therapeutic window. The difference between an effective dose and a toxic dose is frighteningly small. Taking just 50% more than recommended can begin damaging your liver. Myth 3. It's just for pain relief. Actually, Tylenol is equally effective as a fever reducer. It works by blocking cyclooxygenase enzymes in your brain that signal pain and regulate body temperature. But here's what most people don't know. It barely reduces inflammation, unlike ibuprofen or aspirin. Myth number 4. You can't overdose on over-the-counter medications. Acetaminophen overdose is the leading cause of acute liver failure. In the Western world, it's responsible for more emergency room visits than any other medication, prescription or over-the-counter. Now, let's talk about what happens when things go wrong. I'm not trying to scare you, but you deserve to know the real risks. Liver damage, the silent killer. Your liver is the only organ that processes acetaminophen. When you take Tylenol, 90% is safely processed, but 10% creates a toxic byproduct called NAPQI. Your liver produces glutathione to neutralize this poison. But if you take too much Tylenol, you deplete your glutathione stores. And here's the terrifying part. You won't feel liver damage happening. There's no pain, no immediate symptoms. By the time you notice yellowing skin, dark urine, or abdominal pain, 70% of your liver cells might already be dead. The numbers you need to know. Maximum daily dose, 3,000 mg, reduced from 4,000 mg in 2011. That's just 6 extra strength tablets in 24 hours. Taking 7,005 mg in one day can cause liver failure. Chronic users who take 4,000 mg daily are at significant risk. Alcohol multiplies the danger exponentially. Other serious side effects. Recent studies have linked regular acetaminophen use to increased risk of asthma and allergies in children, Potential kidney damage with long-term use. Possible increased risk of ADHD when used during pregnancy. Reduced empathy and emotional processing in adults. Increased risk of high blood pressure with regular use. But let's be fair, Tylenol became the world's most popular painkiller for good reasons. What it does well. Excellent for headaches, muscle aches, and arthritis pain. Highly effective fever reducer for all ages. Doesn't cause stomach bleeding like NSAIDs. Safe during pregnancy when used correctly. Doesn't interfere with blood clotting. Works well for dental pain and post-surgical recovery. Why doctors recommend it. Physicians often prefer acetaminophen because it has fewer drug interactions than alternatives. It's also the go-to choice for people with stomach ulcers, kidney problems, or bleeding disorders who can't take aspirin or ibuprofen. But avoid Tylenol if you drink alcohol regularly more than 2 to 3 drinks daily, have any liver disease or hepatitis, take blood thinners like warfarin, are on certain seizure medications, have a history of drug allergies, are taking other medications containing acetaminophen. Use with extreme caution if you are over 65 years old, have kidney disease, are underweight or malnourished, are taking multiple medications, have glucose 6-phosphate dehydrogenase deficiency. But Tylenol is safe for most people when you follow dosing instructions exactly. You don't exceed 3,000 mg in 24 hours. You avoid alcohol while taking it. You don't combine with other acetaminophen products. You use it for short-term relief only. Now, many of you are probably wondering, are there natural alternatives that actually work? The answer is yes, but with important caveats. Proven natural pain relievers. Willow bark, nature's aspirin. This is where aspirin originally came from. Contains salicin, which converts to salicylic acid in your body. Studies show it's effective for lower back pain and osteoarthritis. Typical dose, 120 to 240 mg daily of standardized extract. Turmeric curcumin, the golden healer. Multiple studies confirm curcumin's anti-inflammatory properties. Rival ibuprofen for arthritis pain. The key is bioavailability, combined with black pepper extract or in a specialized formulation. Effective dose, 500 to 1,000 mg daily. Ginger, more than just nausea relief. Research shows ginger can reduce muscle pain by 25% and is particularly effective for menstrual cramps. It works by blocking inflammatory pathways. Fresh ginger tea or 250 mg supplements twice daily. Omega-3 fatty acids, the long-term solution. EPA and DHA reduce inflammatory markers throughout your body. While not immediate like Tylenol, regular use can significantly reduce chronic pain. Minimum effective dose 2 to 3 grams daily of combined EPA. Magnesium, the forgotten mineral. Magnesium deficiency is linked to increased pain sensitivity. Supplementation can reduce migraine frequency by 40% and help with muscle cramps. Magnesium glycinate, 400 to 600 mg daily, is best absorbed. Mind-body approaches. Don't underestimate the power of meditation and deep breathing, regular exercise and stretching, adequate sleep 7 to 9 hours nightly, stress management techniques, hot-cold therapy, massage and acupuncture. Important disclaimer, natural doesn't automatically mean safe. Always consult your healthcare provider before trying new supplements, especially if you're taking medications or have health conditions. Some natural remedies can interact with drugs or have their own side effects. So there you have it, the complete truth about Tylenol. It's neither a miracle cure nor a dangerous poison. It's a powerful tool that, when used correctly, can provide safe and effective pain relief. When used incorrectly, it can be deadly. Key takeaways. Remember these crucial points. 1. Never exceed 3,000 mg in 24 hours. 2. Avoid alcohol when taking it. 3. Check all your medications for hidden acetaminophen. 4. Consider natural alternatives for chronic pain. 5. When in doubt, consult your healthcare provider. Your health is your most valuable asset. Whether you choose Tylenol, natural alternatives, or a combination of both, make informed decisions based on facts, not fears or assumptions. If this presentation helped you understand Tylenol better, share it with someone who needs this information. Knowledge saves lives, and together, we can make sure everyone uses medications safely and effectively. Thank you for your attention, and remember, you now have the power to make informed choices about your health. Stay safe, stay informed, and take care of yourselves.